Okay, welcome back again in our series of lectures about tropical diseases, and today we are going to focus on malaria as a tropical disease of protozoa origin. Uh, malaria is the inflammation or the infection of the body by Plasmodium species, which is manifested with high fever. So the most common cause of malaria parasite in our setup is Plasmodium, and that's like Plasmodium vivax, Plasmodium ovale, Plasmodium malaria, and also Plasmodium roense. Vivax and ovale are known to cause hepatic cycle, whereas malaria is associated with renal disease, whereas nonsense is associated in southern east of Asia. It is transmitted by the female Anopheles mosquito because the female Anopheles mosquito comes to human being to do what? Comes to human being to feed so that the eggs can mature. So, naturally that the mosquitoes feed on nectar, but the female one has to feed on human body blood so that the eggs can mature. So the prevalence of malaria is that the malaria is a disease of the tropics. It has, especially where Kenya is, but these other countries are not affected by malaria, like the Northern America, the Northern European, the Southern. So it is around them because of a good humidity, and that is where the malaria is very common. So per case definition of malaria is that if there is malaria, if malaria cases extinct even in one number from the previous period of time of study, that means there is an epidemic, or what you can say there is an outbreak of malaria. So for the example, in the year in the year 2023 show that there is an increase in number of cases of malaria from 243 to 247. That means there was an outbreak or rather epidemics. So let us look at life cycle of malaria. Life cycle of malaria is can occur in human being. Life of malaria can also occur in mosquito. In mosquito, you call it invertebrate, whereas in human being it is vertebrates. Or in human being, we can say it is the sexual part of it, whereas in the mosquito, you can say that it is the sexual part of it. So when the mosquito feeds, is feeding, and that bites you, it deposits sporozoites from the saliva. These sporozoites disappear for around that minute. They appear in the liver as hepatic, in the liver as hypnozoites, which are dominantly in the liver, and then they mature there in the liver into what we call schizons. And this schizon disease is merozoite. These merozoites affect the red blood cells, and these red blood cells they have what we call in the red blood cells they are found trophozoites, and these trophozoites can affect another cell or red blood cell, or also can also affect a liver cell, so the cycle can continue there. So that is where the life cycle of vivax and ovale always persist. Then again, it can affect even the other red blood cells, and also another life cycle can continue there. So there is a life cycle around the red blood cells. There is a life cycle around the liver. So these ones also these ones gametocytes, which is male and female, because in the liver, in the red blood cells, this is where the cell division, the asexual part of which multiply. So when the mosquito is feeding on you, it takes the gametocytes. In the mosquito, the gametocytes are converted into microgametocytes, and then the microgametocyte, then zygote, then okinetes, and then in the zygote there is okinete, then oocyst, and this oocyst burst, and then it does what? It releases sporozoites, which when it is feeding, the next time it deposits them into your body. So the most common types of symptoms of malaria is fever, headache, chills, and vomiting. So the symptoms of malaria are not very, very big. So, and they always appear 10 to 15 days after the person is infected. If not treated promptly, the effective medicine malaria can cause a severe death. It can cause severe illness and death. So in the stage one, patient feels cold, chills 15 minutes to 1 hour, then this goes of rupture from the host cells, and then this is and because when the red blood cells are rupturing, there is augmentation of the immune system or inflammation, and then the immune system causes this fever and also it's painful. So the presence also in nausea, vomiting, headache in stage 3, there is a fever more than 40 degrees, lasts for several hours because it is invading new red blood cells. So in stage 3, there is this what we call sweating stage. We see it start sweating. There is episodes of cycles frequently, and this paroxysmal occur after 48 hours. In Plasmodium malaria, pyrexia may last for 8 hours or more, and the temperature may exceed 41. So, commonly, the patient may manifest with fever, chills, sweating, headache, nausea, and vomiting, and sometimes body ache and general malaise. Then again, there are various things like when there is complications, patient can manifest confusion and drowsiness, extreme weakness, frustration, and sometimes may develop alteration in consciousness, can confusion and deep coma. Sometimes cerebral malaria can cause coma, and this is associated with paracetamol malaria. Respiratory distress because of metabolic disturbances and also pulmonary edema. Multiple generalized convulsions show pulmonary edema, abdominal bleeding, jaundice, hemoglobinuria, acute renal failure, severe anemia, and eye fever or hypoglycemia are one of the few most common effective complications of malaria. So there is several malaria. Severe manifestation of malaria is like cerebral malaria, severe anemia, failure, and others. So in cerebral malaria, patient will have may have may begin slowly, then progress, and the outcome is that there is high fertility of around 12%, and with success, ultimate recovery is good and permanent disability may rarely occur. Whereas in the severe anemia, patient will manifest with things like jaundice, anemia, nutrition of the abdomen because of hyperactivity of the liver and also the spleen. And this sometimes also can be manifested with what we call atrophic bowel splenomegaly. Then there is renal failure patient as a current urine, and this one, if the patient is in the written very well, the cells is very clear, and sometimes patient can be done what peritoneal may be needed sometimes. So other complications are like hepatic dysfunction, hypoglycemia, shock, pulmonary edema, fluid and electrolyte imbalance, vomiting, diarrhea, secondary bacterial infection, bleeding, clotting, and disturbances, hemoglobinuria, and also black water fever. Why is malaria Plasmodium falciparum of concern? Because it can produce further complications like cerebral malaria, malaria hyperpyrexia, gastrointestinal disorder. It can also cause shock and also can cause black water fever, which can lead to death. Yes, is Pernicious malaria is a life-threatening condition acute parasitic malaria. It is due to every parasite, and it manifests with number one, several malaria. It presents with hyperpyrexia, coma, paralysis, and sometimes brain condition. In aggravated malaria, it presents with cramped skin leading to peripheral circulation failure. So malignant malaria can affect the brain and the rest of the central nervous system. It is characterized by change in the level of consciousness, convulsions, and paralysis. So present in hyperpyrexia can lead to coma, paralysis, and other complications, brain appear congested. So this is what an example of a brain the cerebral malaria. So a black water fever, a type of malaria. In malignant malaria, a large number of red blood cells capsule are destroyed, and then hemoglobin from the red blood cells is excited in the urine, which therefore is dark and almost the color of Coca-Cola. So, how do we test for malaria? You have to learn from microscope. You can do QBC, you can do a rapid test, you can do a PCR. It's an example of a blood slide malaria being prepared. Malaria parasite can be identified by examining under the microscope and drop a patient drop spread out as a smear. And on a microscope, prior to the examination, the specimen is stained with a gems stain to give a parasite a distinctive appearance. This technique maintains the current way of diagnosing malaria. So Plasmodium ovale, that is how it looks like. That is how it looks like. It's called Gibson's dots or Scott's dots. So the QBC malaria method is the simplest method tested to diagnose the foreign diseases like malaria, babesiosis, trypanosomiasis, like Chaga disease, sleeping sickness, and filariasis, and the relapse fever. This is QBC in terms of malaria. So these are called the tropical protozoa type of diseases. So that is how it looks. Parasite in a QBC system, malaria parasite look like that. So you can also do antigen detection using a serological type of test to test malaria parasite. So you can also do PCR. That one you check the parasite nucleic acid polymerase chain reaction. And also this is the most sensitive antibody detection PCR blood are the most important in this type of test. So Vivax and the P. malaria infection, we see that we have a hepatic cycle, which can remain there for many years and are recovered and efficient recovering from the first episode of illness will suffer several additional attacks, like relapse. So after months or even years, you will symptoms. So relapse occur because of Vivax and P. malaria dominant liver stage parasites that may reactivate. This type of patient also there are times we call what we call carriers of malaria. So what is the management of malaria? There is various types of malaria guidelines depending on the country of where it is going to be treated. In the country, for example, the treatment of uncomplicated malaria, principal malaria is the drug of choice. You give antihistaminic drug, that is ACT, are the recommended one. At least they're supposed to be given at least 3 days. So in this ACT is the WHO recommends Ateneda plus Mepantrin, which is currently used in Kenya, AL, then artesunate plus ammonium. Then we have artesunate plus naproxen, we have artesunate sulfur and pyramidamine. Pyramidamine sulfur again, pyramidamine is part of the sulfur part of cells, except in the Then we have the artemisinin and piperacillin. So in this case, you can see that artesunate is being combined with all these drugs. So second line anti-malaria treatment is you can give artesunate, tetracycline, or cycline, or clindamycin, or these combinations to be given for 7 days. You can also give quinine. You can also give quinine, and remember the toxicity of quinine in what? In hypoglycemia and also arrhythmias. So avoid mosquito bites. This is the best way to prevent. Avoid wearing long trousers, long sleeves, insects, treating place, and repellent or are the best way to prevent malaria. So sometimes malaria can be even some chemicals to prevent, like for example, pregnant mothers have to be given a sulfur drugs people who are traveling to places with malaria can also be given drugs to prevent malaria in those areas. Yes, and also children, people with the sickle cell disease also are given anti-malaria or prevention for malaria and prevention. Okay, thank you very much for the Stanley of malaria.